from the midline. The first artery, about 1.7 centimeter from the midline, is the supratrochlear vessels. And 2.7 centimeter from the midline, we have the supraorbital vessels. This is very simple by numbers. I don't like it so much, so I have to find another way to precise my location for these arteries. So just simply, I put my hand at the midline, and my thumb here more lateral. I do compression of the tissues. You will find these two kind of creases when I squeeze the layers of the skin in the forehead. The medial one is the crease where below it directly we have the supratrochlear artery. The lateral crease is the crease in which below it directly we have the supraorbital artery. This is the way. We have another way. Just ask the patient to frown. The same as you do for evaluation of the corrugator muscle before botulinum toxin injection, you ask the patient to frown. When the patient frowns, she will find what's called corrugator crease medially, and laterally we have a dimple. And this dimple is called the supraorbital crease. Simply, the corrugator crease, we have the supratrochlear vessels, and at the corrugator crease, we have supratrochlear, and supraorbital crease, we have the supraorbital artery. So when we inject here, we have to respect in the forehead, in the eyebrow, and the glabella, the supratrochlear and supraorbital artery. There is very special course for both arteries. When they comes out from the foramina, from supraorbital or from the orbit at the supratrochlear artery, they are deep. In the first 2 centimeters just above the supraorbital margin, both the supratrochlear and supraorbital arteries are deep on the bone. At 2 centimeters, they change the course from deep to more superficial. Again, as the first 2 centimeters above the supraorbital margin, both arteries are at a deeper level. It changes the course when they pass around the 2 centimeters from the supraorbital margin to be from deep to a superficial course. So simply, as I will say, we have here to know, when you have a deep artery, where you have to inject, deep or superficial? And we have a superficial artery, we have to inject in another direction. So the level of the artery, or the depth of the artery, it will precise my own way of injection, where to inject, okay? So it will change from deep to more superficial, just above 2 centimeters. Now, the question is, when I inject, this is the forehead. When I inject in the center, like the lateral part, when I inject in the upper, like the lower part, no. This is how we can know where to inject each area separately. So the middle line, the D line, is the line just 2 centimeters above the supraorbital margin. So when now we inject in the central part, upper part, when I want to inject this area, I should know where will be the level of this structure to know what will be the level of my injection, what will be the depth of my injection. Now, these are the layers of the forehead in this area. We are not going to details. Simply, the artery is present in the superficial part because it is above the 2 centimeters. So here we have to inject deep on the bone. How? The best way is by needle. Go to the bone, up to the periosteum, and inject. Am I afraid from arterial structure? No, because the main arteries, which are the supratrochlear and supraorbital and central artery, which is branch from the dorsal nasal artery, are present in superficial level. So when your artery is superficial and you go down to the bone, you are in a safe area. So this central area above 2 centimeters, you have to inject superficial. What will be just below the line in the center? These are the layers of this area of within 2 centimeters above the supraorbital margin. These are the main structure present. We have the supraorbital artery, supratrochlear artery. We have, of course, supraorbital nerve, supratrochlear nerve. But here, this artery at a deep level because they are below the 2 centimeters of the forehead. So when you inject, please inject superficial. Now, what to be about the lateral part? In the upper part, we have the supraorbital artery, and don't forget, when you inject here, the upper part is not only supraorbital and supratrochlear artery, which are present in superficial level. We have the superficial temporal artery. When I'm talking about the temple, I will mention the course of this artery. It passes in the forehead, also in superficial level. So both arteries, supratrochlear and superficial temporal artery, are present in superficial level, where we are expecting to inject, superficial or deep. If I ask you, you want to inject in this area, it is better to inject superficial level or deeper level? This is the way you have to inject deep, because the arteries in this area is more superficial. What about the lateral part lower? These are the layers passing through all the layers of the muscle teeth, the periosteum, which is the frontal bone here. What we can find here, we have a supraorbital bundle, which is the medial border, and have the temporal crest. We have a supraorbital artery, and we have what is called deep supraorbital nerve. So the main structure here is medially, it's supraorbital artery. So simply, when you inject, please inject up. If you want to inject the forehead in the lower part here, we have the supraorbital artery. It is better to inject more superficial. If you want to inject deep, you can inject deep, but simply use cannula. If you want to be safe and not to injure, use cannula at least 25 gauge, not 27. So simply, you can inject deep, yes, of course, but not by needle. What about the eyebrow? We have the lateral eyebrow and we have the medial part. This is the lateral part and this is the medial part. These are the level of the lateral part. Sorry. Okay, so where is the artery? It's the mid-pupillary line. We have the supraorbital foramina. We have the supratrochlear artery here. Okay, so simply when you want to inject deep, but inject it by cannula, please, because you are injecting at what is called the deep fat, the roof. What about the medial part, the lateral part, sorry, we have the inner cancus and mid-pupillary line. We have the inner cancus and mid-pupillary line. So what we have here, we have the supratrochlear artery at the inner cancus, and the mid-pupillary line, we have supraorbital artery. So simply, if you want to inject, again, inject deep, because we need to inject in the deep fat of the eyebrow to have an effect to lift the eyebrow. But when we inject deep and the arteries are deep, no way to use needle. Please use cannula. What about the glabella? If you need convexity of the forehead, sometimes you need to convex the area of the lower part of the forehead, which is the glabella. Also, if you want just to lift the medial part of the eyebrow, sometimes you need to inject at the glabellar area. And when you inject the bone, which is more advanced, you say it in the advanced course, you need to adjust this angle between the nose and the glabellar region. So what about the glabella? These are the layers. As you can see, we have multiple muscles. We have orbicularis muscle, frontalis, corrugator, till the frontal bone down. So these are the layers in the glabella. So where it will be the main arteries? We have arteries at a deeper level, which are the supraorbital, supratrochlear artery, and we have upper superficial, which are the central artery and the paracentral artery. So what will be the level for injection? Here, if you inject very superficial, and this is something what here at this point I inject the lines of the glabella here intradermal. You have to see blanching. When you inject a filler in superficial level, you have to see blanching. This is what is called blanching technique. And why I inject very superficial? Because I don't want to hurt the central and paracentral artery. You can inject deep, yes. But when you inject deep, no way to inject by needle. Inject by cannula. Now, so when we have a glabellar line, inject superficial in a way of